So the challenge for cancer in London is that we have two main problems. One is we have a challenge with late diagnosis. So patients are not coming to medical attention early enough in the course of their disease. And the second is too much variation in outcomes. So that means the clinical chances of cure and standard treatment for patients across the capital. So joining up the data from the point at which a person first goes through the medical services, whether that's cancer screening or going to see a GP or a pharmacist or dentist with a symptom, through to getting to the hospital. That's the first part of the diagnostic pathway. And it's really important to understand how well that works for different communities, both in terms of where people live, their educational background, their socioeconomic background, maybe their cultural background. All these things can influence how readily people access and use the health service. And so in order to really understand the diagnostic part of the pathway, we need to be able to join together information that gives us that level of detail about the people coming through. And then secondly, even once you come to the hospital, actually confirming a diagnosis of cancer, which type of cancer it is, how far it may have spread, and how well you respond to initial treatment, all of these things can affect your overall treatment plan and your long-term chance of cure.
So it's all about using the data that exists, bringing it together so that it's accessible to researchers so that they can design better treatments, know the landscape, know who has access to the best therapies and improve outcomes for all.
The depersonalised data, which in fact we were able to use last year across a number of NHS trusts, including a number in London, had a very significant impact in highlighting the problem on excess deaths. And that then is a driver both at policy level, but also for the NHS itself to start to think about solutions it can adopt. But the only way that you can adopt the right solutions is to have real-time data about what's going on now that's affecting cancer patients.